And joining us now on the program, pleased to have with us Dr. Paul Sundberg with the Swine Health Information Center. Dr. Sundberg, always great to chat. How are you, sir?
I'm well, thanks, Jesse. It's good to be with you.
Appreciate the time. Let's dive right in. Obviously, swine health is a big topic for our producers across the country. African swine fever has been in the news now for what seems like forever. Just want to get a quick update with you on the status of ASF. And I know as well there's some vaccine news coming out of Vietnam, so we could barely talk about that as well a little bit. But what's just the overall status of ASF right now globally?
Yeah, globally, ASF continues to move around. Probably one of the most significant things that happened just within the last couple of weeks is that a farm in Western Germany, practically on the border with France, has been identified with African swine fever now. It's a small farm, but it's miles and miles away from the eastern side where the wild boar are going around with African swine fever, and you get a commercial outbreak every now and then. It's an illustration, I think, another example of ASF being able to be transported at 60 miles an hour down a highway because somebody had to move that virus through a product or some other manner all the way across Germany to that farm in eastern or western Germany now by France. So that's a big deal. We continue to work on ASF in the Dominican Republic on the island of Hispaniola. Haiti is a big challenge because of all of the issues that they have with government and control there. But the Dominican Republic is starting to make some progress in their eradication program. The number of farms that have been identified as positive are starting to go down. They're doing the depopulation of positive farms. And so hopefully they're making some progress. And I think that's the good news for the Dominican Republic.
Now, talking vaccine news, we've been trying to find a vaccine for African swine fever. There's some news coming out of Vietnam. What's the latest there, Dr. Sundberg?
Yeah, the Vietnam Ministry of Agriculture just had a press conference last week, and they announced the intent to start the commercialization and delivery of African swine fever vaccine. This is a vaccine that's based on a prototype that comes from Plum Island, from the USDA on Plum Island. And a company in Vietnam's been doing testing over there for safety and efficacy. They found that the safetiness is fine. USDA made an announcement that they didn't find any reversion to wild type virus. It's a modified live, so there's always a question about whether or not it can flip back to being wild. That doesn't seem to be an issue. It seems to be effective. One of the things about this vaccine is that it doesn't stop infection. It doesn't prevent infection, but what it does is it stops death. It stops the production effects of the virus. That's a big step forward. There's a lot of things that have to happen with that vaccine to make it ideal, but at least that's a big step forward. It's not yet available commercially. It's not yet available on the market. Vietnam still has to approve putting it on the market, but apparently they're pretty close right now. So that's probably some good news, at least for Asia and Southeast Asia.
I know as well, another virus we're watching in Australia, Japanese encephalitis virus, JEV. Talk about this a little bit. This is something that doesn't necessarily sound too great either for the hog herd in Australia.
Yeah, not for the hog herd in Australia. And I'll tell you what, this is kind of like why SHIC was built. We had PRRS in the late 80s. We had circovirus in the late 90s. We had PED in 2013. And now JEVs in Australia. We've got to pay attention to this. It causes pretty severe reproductive issues. There are extended farrowings, extended gestation past the normal gestation time, causes abortions, malformed fetuses, a lot of problems. And what's going on in Australia right now is about 60%, the reports that I get from Australia, about 60% of the sites in Australia are affected. They've had as much as 3 to 10% of their overall production for the year that's going to be affected. When you get into the 10% range, that's what we estimated happened with PED back in 2013. So that's pretty severe. It is transmitted by mosquitoes. The mosquito picks up the virus from what's called a reservoir host, which is birds, all kinds of birds, especially waterfowl, and bite pigs. They can bite pigs, and pigs are amplifying hosts. So they produce more and more virus that the mosquitoes will pick up and go to the next host. One of the most important things, as well as production with JEV, is that it's also a zoonotic disease. In other words, it can infect people. And they've had over 40 infections in Australia of people that have gotten JEV and as it's circulating, as well as they've had deaths. The last count that I had, they had 4 people that died from this. So it's significant both for human health as well as for swine health.
Well, something to keep our eye on for sure. JEV virus in Australia right now. Dr. Sundberg, you mentioned PRRS too. I should get an update there. I know we've heard a lot of PRRS cases throughout parts of the country here this spring. Any updates to what's going on with PRRS right now?
Yeah, right now PRRS seems to be very regional. There are specific outbreaks in Nebraska and Iowa, southern Minnesota. I believe it's in Illinois or Indiana as well, Missouri. So it is central here, but it's very regional within specific states. Overall, across the country, PRRS is within the limits of what we would expect to be happening for this time of year. It is seasonal. So as we go into the summer, we are expecting that it's going to be decreasing. But that doesn't mean that that's good for everybody, because there are certainly regional outbreaks of different strains that are happening that producers have to pay attention to.
Well, Dr. Sundberg, always appreciate the time and catching up with you in the Swine Health Information Center. Any final thoughts you have for us today?
You know, I'll tell you, Jesse, the thing that I want to emphasize is the collaboration that's gone on with this issue about Japanese encephalitis virus with USDA, as well as the collaboration that we have with the Pork Board, with NPPC and American Association of Swine Veterinarians. It's a big effort, and we're still on the wall trying to help with the U.S. pork industry.
Well, we always appreciate the time, and thank you for joining us as always. With that, Dr. Paul Sundberg with the Swine Health Information Center. You can learn more online, swinehealth.org. Dr. Sundberg, thanks so much for the time.
My pleasure. Thanks, Jesse.